Patient safety is always something that has been important in healthcare. With the evolving technologies that healthcare today is equipped with, we as a society have set high expectations. These high expectations are trying to be met every day by healthcare professionals. But with so many patients needing access to healthcare, how are they able to maintain this high level of care?
These are the 4 parts our video will focus on. The first part is the background, where we will give some basic information and history on patient safety. The second part is a skit, where we show what would happen if patient safety protocol wasn't followed. The third part is where we will analyze the skit and explain how the patient safety protocol works. And last, we will have our conclusion, where we will summarize the key points of the presentation. The World Health Organization defines patient safety as the prevention of errors and adverse effects to patients associated with healthcare. In 2005, the federal government created a national reporting system for patient incidents, Patient Safety and Patient Quality Improvement Act. This created a nationwide network of patient safety organizations for the purpose of gathering and analyzing information about patient incidents. The patient safety organizations have expertise that identify the risks and hazards in the delivery of patient care, determine underlying causes, and implement preventative strategies. Improving patient safety is a multifaceted task that requires involvement of all team members in a healthcare system. Nearly 25% of discharged patients experienced an adverse event in the transition from hospital care to care at home or in the community. Successfully preventing adverse events relies on comprehensive and systematic data collection and analysis. Therefore, participation among staff is essential. The mandatory reporting systems focus on serious and fatal incidents, while voluntary systems are often used for less severe events. Both require support and cooperation of healthcare workers. Preventing adverse events requires an understanding about how they happen and making the necessary improvements.
The following video will illustrate a patient who has been diagnosed with a hernia and has been approved for surgery. The video will demonstrate how patient safety practices were not followed and what adverse outcomes occurred as a result. There will be 3 patient safety errors that the patient safety organization representative will acknowledge. The purpose of this video is to demonstrate how important it is to follow patient safety practices and regulations in any healthcare setting and the impact patient safety has on quality improvement.
Hi, I'm Dr. K. I'll be your anesthesiologist. I'm the one who's going to put you to sleep.
Okay.
Do you have any questions?
No.
Just count backwards from 10 for me.
10, 9, 8, 7, 6, 5, 4.
Okay guys, so we have Mr. Smith here. He's 54 years old and he has a hernia in his small intestine. So we're going to do a small incision and hopefully get the hernia out. You guys ready for this?
I'm ready.
Yep, he's out.
Okay. Megan, do you want to pass me the scalpel?
Here's our first patient safety issue. As you can see, the surgeon is wearing her wedding ring. This is a clear violation. In addition, the surgeon is not wearing gloves, a clear sanitation issue. Also, it is an easy way for the patient to contract bacteria from the surgeon or the surgery room. By the way, you should be wearing gloves.
Okay. Ready?
Ready?
Okay.
All right.
Thanks.
drop the scalpel.
Oh well, 5-second rule.
Here's our second patient safety issue. The nurse dropped the scalpel and continues to complete the surgery. This is a clear violation of sanitation practices. Instead of asking for a new instrument, she continues the surgery, allowing bacteria to enter into the patient.
Here you go.
Oh gosh. It's a toughie.
Oh, I see it. All right, I'm gonna grab
there
it.
you go. Okay, so we're gonna finish off here. So I'm just gonna sew them back up here at the bottom.
Okay.
As you can see, this is our final patient safety issue. The surgeon clearly drops her wedding ring into the patient while performing surgery. This can clearly cause complications in the long run for the patient.
Hello.
Hi.
I'm Dr. Najawan. Okay, let's look at your records here. Mr. Smith, so I see that you had a hernia operation with me about 2 weeks ago. How are you feeling?
Not so great. Kind of have discomfort all around this area, around my stomach.
Oh, that's pretty odd. Your surgery went pretty well. Why don't we take a look at your x-rays?
Here are the x-rays you wanted?
If you have time, do you mind pulling them up for me?
Sure.
Let's take a look.
What is that?
Oh, it's nothing. Don't worry about it. Can you put the next x-ray up? Yep.
This is unacceptable. Why is your ring inside of my stomach? That's what's been causing me problems all this time.
I honestly have no idea how my ring got into your stomach, as I followed all regulations and protocols.
This is unacceptable.
I'm extremely sorry.
I think I'm going to contact the patient safety organization because this isn't reasonable what you guys did to me.
As you can see, this is a very serious issue that occurred with one of our patients. Patient safety is an important aspect of quality improvement in a healthcare organization. This organization needs to implement a patient safety program to ensure safety guidelines are followed and to ensure that errors in the future do not happen like this. In fact, nearly 25% of all discharged patients experience an adverse effect in the transition from hospital care to home care.
The healthcare system today puts great emphasis on patient-centered care. Due to the stress aspect of healthcare, it is important to ensure minimal risks surrounding medical treatment in all aspects of patient care. Therefore, patient safety as part of quality improvement cannot be stressed enough within the healthcare practice. Protocols and regulations are established by professional colleges and governments to ensure a safe practicing environment for both patients and medical staff. If protocols and regulations are not followed, serious consequences are to be expected. Within the video, protocols were not followed. Mistakes were made, which put the patient and medical staff in jeopardy. In 2010, the Excellent Care for All Act was created to place top priority on patients in Ontario. The Ministry of Health states that this helps define quality for the healthcare sector, reinforces shared responsibility for the quality of care, builds and supports boards' capability to oversee the delivery of high quality of care, and ensures healthcare organizations make information on their commitment to quality publicly available. The Health Quality Ontario website, provided by the Government of Ontario, collaborates with the Council of Academic Hospitals in Ontario and adopting research to improve care. They publish information and guidelines for patient safety and quality improvement, focusing on patient-centered care. This is a resource for medical personnel and the public by which information regarding how to increase favorable outcomes while decreasing the risks to patients is provided. With increasing amounts of growth and information, improvements to guidelines and regulation are continuously being made, ensuring improvement to patient safety. Methods to improve patient safety and work efficiently include communicating with the medical team, improve patient understanding and communication, following protocols and guidelines, having clear and constant leadership, proper education and review of regulations, creating a safety-oriented community, implementation of a reporting system, admitting mistakes without fear of repercussions, and full disclosure. It has been established that quality improvement in healthcare is extremely important and also comprises of various aspects in order to obtain full quality. Patient safety, the topic of today's presentation, is extremely important as the patient is the focus of care in most practices. The number of individuals exposed to these preventable events is relatively high and could be reduced if providers work more cautiously and attentively to patients. For example, nosocomial infection contraction within acute healthcare hospitals affect 1 in 10 individuals, and the same ratio is mirrored for patients who receive wrong medications or doses of medication in their treatments. It is important to address these issues as many people are affected by it. Some ways to prevent medical error include the following. Notify your doctor of all prescriptions and supplements you take. Ensure the physician knows of all the allergies and adverse reactions you may have to medicine. Ask questions and address concerns. Ensure that procedures and surgeries are performed in hospitals with great experience. Ensure that both the doctor and surgeon agree on what will be done. Ask your doctor to explain at-home treatment plans in detail. Ensure prescriptions are legible. Physicians should be addressed and disclosed to the patient so that it can be dealt with as soon as possible. This can be done by increasing healthcare teamwork, by working in more effective teams, increasing staff happiness, and decreased turnover rates leads to fewer accidents and injuries to patients. Also, increased communication would mean that effective communication to all parties eliminates errors as everyone is on the same page. In an effort to improve patient safety and improve overall quality of care, in the past decade, a lot has been done. A national reporting system was made. Organizations now have experts that identify risks, and today, all team members in the healthcare system are involved in improving patient safety. Over a long period of time, the healthcare system has learned from its mistakes and used those experiences to improve the system as a whole for future patients. Hopefully with this method implemented, we will see better care for all moving forward.